Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on your health. My first guest serves as the city's chief advisor on health. Bevan Baker is the commissioner of health for the City of Milwaukee Health Department. Welcome back to the show.
I'm glad to be back. Thank you.
Always a pleasure to have you here. And about 6 months ago, you and Mayor Barrett released the 2015-2016 City of Milwaukee Community Health Assessment. And that report detailed information in more than 100 measures across 21 core variables on the health status of city residents as well as conditions that impact health. Now, what were some of your findings as far as the biggest concerns when it comes to health?
Well, what we found out from residents in our city, that people are concerned about their physical environment. They want a safe place. They want places where they can get clean food, good food, clean water, fresh air. We learned that people are concerned about access to health care. They want to be able to get health care. They want to be able to be insured. They want to be able to be healthy. We've learned so much, and that's why we wanted to engage residents, so that they could help us decide how we can become the healthiest city in America again.
Yeah, and I'm guessing that you partnered with a lot of different organizations that treat residents, and they were able to help you compile the details you need for this.
It was all hands on deck. It's about 100 organizations that we partner with and we have relationships with.
Mm-hmm.
We want to reach people where they are.
Right.
But people are more likely to tell you what you need to know if they trust you. So that's why we wanted to work with many organizations who are already on the ground. So we got a wealth of information.
Yeah, and when we talk about health in itself, it's not just, you know, is my immune system strong and things of that nature. When you talk about violence, it sometimes becomes a health issue. You talk about stress, and then even academically, we have young people living in our community who are behind when it comes to reading in comparison to other cities in America. So all these things kind of fall under the umbrella, correct?
And that's a great umbrella, and it's the social determinants that impact our health. Mm-hmm. We're finding out more and more that those things that you talk about, transportation, education, you know, income, working and getting a job, those things impact our health just as much as some of the physical conditions that we're familiar with.
Yeah, and with that said, you've got your first step to health improvement, and that is your Community Health Improvement Plan, also referred to as CHIP. Fill us in on that.
Well, the CHIP, I've been saying that a lot today. The CHIP is where we really engage the community. It's a community-led. This is where the community helps us prioritize a plethora of things that we're concerned about with our health. We can't do them all, but we need to do the things that matter most to the community. So the Community Health Improvement process is just that. It's driven by the community, and it gives us a chance to engage them. And we really need to get out there. So we're doing that now. We're really excited about that process. It's interactive. A lot of great stuff is happening.
Yeah, and you as in the health department as a whole, you've actually come together and figured out what it is you need to do to raise awareness and get the information that's important to residents of the city out there. So you have what's called MKE Elevate. Tell us more about that.
Well, this MKE Elevate is our campaign. It's the campaign to bring awareness to that whole community health improvement process. And while there's surveys that you can take that inform us, and I encourage people to go to our website to do that, there's things that are happening now. There's our photo voice that's happening, where we're asking people to take pictures all over the city of what they see healthy and what they see unhealthy. Thousands have done it. The more we get, the better. So that MKE Elevate is an awareness campaign. What we want to do is to elevate the health status of Milwaukee to once again put us back in our rightful place as the healthiest city in America.
Yeah, I'm glad you brought that up. So are we no longer on the list at all?
Well, I think the state of Wisconsin always ranks in the top 10 and sometimes top 15 healthiest states in America. So great statewide, but yet we have many health disparities that are here in Milwaukee. We used to win that contest all the time. I believe it's sort of like in football season. Everybody believes this is going to be the year we come back. Well, we have to do better than that. We have to move and become the healthiest city in America, and this is part of that process. We need to improve health everywhere.
All right. The last time you were here, we briefly spoke about the issue of lead pipes and water, and you and the mayor recently emphasize the need for residents who are living in homes that were built before 1951 actually get equipped with faucets with filters that are certified to remove 98% of lead from household drinking water. Tell us where we are when we're dealing with this particular situation, which it looks like you guys are trying to be proactive to keep it from becoming something extremely serious.
Well, I think that first let me say lead hazards are a major concern, and there's no safe lead level for the human body. But with what we know, and as we follow the science tells us that until we can remove all of these lead pipes from out of the ground, that we need to look at everything in our toolbox. And one of those things is having a certified filter, NF53 certified, and getting that into the homes that were built prior to 1951, and particularly for homes that have children or where mothers are breastfeeding and or potentially pregnant. We want to make certain that they have everything, every barrier. But let's be clear, the hazards that we face in terms of lead every single day are still there from lead paint. There's nearly 130,000 homes that still have to be abated from lead. We want to have all of our toolbox fighting all of these issues. So there's much work to be done, and I think we're following the science, and we're hoping that we have state and federal officials to help us as well.
And when you talk about fighting that particular scenario of lead paint, you have the City of Milwaukee Health Department has a childhood lead poisoning prevention program that is nationally recognized.
It is, and what we've been able to do since 1997 is reduce the incidence of childhood lead poisoning from about 32% down to about 10%. And we've done that faster than any of the largest cities in the country. But what we hope to do is to do even more. So I think the goal here is to work with our provider community, pediatricians, make certain that parents get their children tested 3 before age 3. That's what we hope to do.
Okay, and there are some serious impacts of lead poisoning. Needless to say, there's a decreased ability to learn, increased behavior problems, increased juvenile delinquency, and reduced health and economic status of the future adult population. So, like I said, serious impact when young people in particular are exposed to lead. So, taking us back to the water, am I correct with the numbers when I say there are some 10,000 residences that were constructed between 1948 and 1951?
Well, what we know is that there are 70,000 lead laterals that are connected to homes that may fit in those categories. That's about 44% of the homes that we want to target. So that number is accurate, but what we can say is that we have to have an all hazards approach to this. You know, water is the lifeblood of all human beings. We need to make certain that our water is safe. The water steps that we take as a water authority, as a city, are to minimize the risk of lead and any other carcinogen in our water. And I think Milwaukee is doing everything it can to make certain our water is safe now and in the future.
So at this point, all of the residents who are known to be connected to those lateral pipes, they have been contacted by mail, and what have they been told?
Well, they've been told that that the water is being treated to minimize the leaching of lead to those lines. They've been asked to flush their lines 3 minutes until that water is much colder, and they've asked if they are in a home prior to 1951 and they meet some of those concern groups to get that filter. So I think we need to work with our community, continually make them aware of the concerns of lead, but we also need everyone to understand that it took us a while to get here. It's going to take us the time to fix this, but we're not going to give up. We're not going to give in. We need to make certain we address this public health concern.
And this public health concern has been recently talked about at a water summit that was held. Can you tell us what was said in particular and who was there?
Well, I think it was great that Marquette University here in Milwaukee was the host of that. And it was great. They brought thought leaders from all over who looked at water and lead concerns, and they had some experts, particularly one from Virginia Tech who's been nationally renowned for talking about this issue, and the mayor attended. I think what was said there is that Milwaukee has done everything that it can do, and there's more to be done, and we've taken steps, and that we're being proactive, we're being transparent, and we need to work. And I think that's why the admission that using filters would minimize and help reduce the risk of lead in our community is one of those key concerns. So I was delighted to attend that summit.
Yeah, and the professor that you speak of, he's a professor of environmental and civil engineering at Virginia Tech. He said that the costly replacement to all lead lateral in Milwaukee could take 20 to 30 years or longer. And he also made mention that the purchase of filters proved to be effective in Flint, Michigan, which we know that their water supply was far worse than what we're talking about right now.
And I think he made an excellent point in saying that this is something that we know works. I mean, we're in the process of working with third-party organizations who are interested in perhaps providing some financial support to help us get more filters. So we're looking at that right now. What we gleaned from that conference and what we already knew, and we had recommended the use of filters prior, is that we need to be much more aggressive in communicating to all who could benefit from that. And I think I'm happy that we're helping get the word out today.
Yeah, and Mayor Barrett will be presenting a plan to replace laterals in his 2017 budget. So that's something that people should probably be listening for and seeing how he plans to approach that.
I think the mayor is very concerned. He's been extremely proactive, and he's working with the health department and waterworks to make certain that for years to come that we have a proactive plan to address this lead hazard.
All right, and one last thing about the lead water, the lead exposure for daycares in some Milwaukee public schools are a top priority for you guys. Talk about that and what's being done.
Well, I think that's where partnerships come into effect. We're fortunate to have some support from the state of Wisconsin, and when we got some money from the state of Wisconsin to address lead hazards, our number one priority is daycares and child care centers, and we hope to be able to leverage that money. There's 385 licensed daycares in the city of Milwaukee. We want to address all of those. We want to make certain that parents who give their children to someone to watch should not have the concern to worry that there's a lead line going there, so we're going to replace those. I think that's a vulnerable population. Children are the most vulnerable. Up to age 6, the ones that we want to be concerned about, but really birth to 3. So that is first out of the gate work that we need to get done.
All right, and lastly, coming up in the next segment, we'll be discussing HIV/AIDS, particularly in Milwaukee County. Give us an idea of where we are when it comes to statistics and the city of Milwaukee fighting this epidemic.
Well, let me first say that our partners in the HIV and AIDS community are never ever sleeping on this issue. This is something that's at the forefront of the work we need to get done. We're seeing a convergence of big concerns right now. We have high rates of sexually transmitted disease. We have an explosion of opioid and heroin and prescription drug abuse, and injecting drug use is going up every single day. Those are the perfect conditions to make an epidemic of HIV and AIDS come back as we saw it in the late 80s and early 90s, and I'm concerned about that. The whole provider and public health community should join with our colleagues who work in HIV and AIDS and implore everyone that this is a sentinel moment in the city and the state's and the nation's history as it relates to curbing and ending HIV. We've got to get all hands on deck. This is a very, very difficult time in the history and the fight against this, and I think our statistics are bearing that out. But I have confidence in our provider community and a lot of our partners who are on the ground every single day addressing this issue.
All right, thank you so much. Always a pleasure to have you come by and fill us in on where we stand when it comes to our health, specifically in the city of Milwaukee. Thank you.
Well, thank you for getting the word out.
Bevan Baker is the health commissioner for the City of Milwaukee Health Department. And when we return to Our Issues Milwaukee, we will continue our conversation about health. We'll find out more about the AIDS Resource Center of Wisconsin and how you can help make a difference by joining the largest HIV fundraising event in the state, AIDS Walk Wisconsin. We'll do that right after this.